Welcome to today's webinar from the International Alliance of ALS MND Associations. Today, we will address mental health in ALS MND. For this webinar, we have English and Spanish captions available. If you're joining us live from Zoom, please check the chat box as we are adding the instructions right now, or scan the QR code on screen if you have another device available. If you're watching the recording in our YouTube channel, you will find the instructions in the video description on how to activate the subtitles. Para este seminario web tenemos subtítulos en inglés y español disponibles. Si se une a nosotros en vivo, vía Zoom, verifiquen en la casilla del chat ya que estamos agregando las instrucciones en este momento, o pueden acceder a la traducción por medio del código QR en pantalla usando otro dispositivo. Y si está viendo la grabación en nuestro canal de YouTube, encontrará las instrucciones en la descripción del video sobre cómo activar los subtítulos. For this webinar, we are using automated captions. Please bear in mind that this kind of translation is not perfect and many variables can affect accuracy, and errors are possible. However, even if a few words are incorrect, you should still be able to get the meaning in context. Thank you to our sponsor, Mitsubishi Tanabe Pharma, without whom this webinar series would not be possible. For those of you who don't know me, I am Jessica May, Programs Coordinator for the International Alliance of ALS MND Associations, and I am joined today by an incredible panel of experts who will provide us with tools and recommendations on how to take care of our mental health. Moderating today, we have Marcela Santos. Marcela is a psychologist with Masters in Social Inclusion of People with Disabilities. Her dad lived with ALS for 16 years, and she was one of his primary caregivers. Her dad had a very positive outlook on ALS, and the way he embraced it was passed to his daughter. Her father, Alfredo Santos, passed away on February 8th of 2020. She has dedicated all her academic and professional life to the care of people with disabilities in Colombia in public and private entities and NGOs. She has been a volunteer psychologist providing psychotherapy to PALs and their caregivers in Colombia since 2014. Besides her academic history and professional experience, the personal experience with her dad has allowed her to give a much more meaningful care to people living with ALS and their caregivers. Joining Marcela in the panel, we have Dr. Rebecca Mills. Dr. Mills has worked as a clinical neuropsychologist in a neuro rehab for 25 years. She achieved her PhD at the University of British Columbia in 1995. She works alongside an interdisciplinary team with adults who have a variety of neurological disorders, including ALS. She does a blend of assessment, group, and individual intervention, consulting and supervision of trainees, but her main passion is in engaging in psychotherapy to assist people in their challenging journeys. Next in today's panel, we have Dr. Melinda Kavanaugh. Dr. Kavanaugh, a social work professor and licensed clinical practitioner, specializes in neurological disorders like Alzheimer's, ALS, and Huntington's. Her research, backed by federal and nonprofit funding, draws from her experience as a medical social worker. Internationally renowned, she focuses on supporting young caregivers and families with ALS and MND, developing evidence-based interventions targeting education, skills, sleep, and mental well-being. As president of Global Neuro Y Care, she leads efforts to aid underserved populations. She's authored books translated into, I hear this morning, 9 languages, and established the Y Care program providing support and education for youth caregivers in the US and South Africa. Joining Dr. Kavanaugh in the panel, we have Dr. Alper Kaya. Dr. Kaya specialized in ophthalmology at Cukurova University Faculty of Medicine. Despite being diagnosed with motor neuron disease in 1990, he pursued his medical career until retiring in 2007. Using assistive technology, he continues his passion for music and is involved in ALS advocacy. He works on music with assistive technology, and he is reviewer and performer of the iHarp Project Assistive Instrument. He's authored a book titled My Index Finger Using a Virtual Keyboard. His short documentary, 4 Walls, 1 Window, received the Golden Ball Award and is active in various associations like the International Alliance. He has been a board member of the Turkish ALS Association since 2007 and a member of UHouse. And completing the panel, we have Sunny Brous. She's a blogger and advocate and a person living with ALS. Since her ALS diagnosis in 2015, just before her 28th birthday, Sunny has dedicated herself to supporting others in the ALS community and spreading love. Her advocacy work, highlighted in both local and national media, includes meetings with elected officials, participation in ALS MND symposiums, and collaboration with various ALS organizations. Sunny is based in Mexico, Texas, shares her journey on sunnystrong.com with a motto of no apologies, no excuses, no regrets. Now, some final instructions. Any questions you have for our panel, please write them in the Zoom Q&A box. I also want to take this opportunity to thank everyone who pre-submitted their questions. There is a lot to cover today, and we will do our best to answer as many of the questions as we can in the time we have. I will now turn it over to Marcela, our moderator for today.
Hello, everyone. Welcome to our Mental Health in ALS MND webinar. I'm super excited to be here. As you know, I'm Marcela. I'm a psychologist, and I was also a child caregiver for my dad who lived with ALS for 16 years. As you could see, it's just presented. We have an amazing group of panelists today, so we just want to get started. To get us started today with today's topic, I'll let Sunny, which is that she's a patient with ALS, share her perspective on mental health.
Hello, my name is Sunny Brous. I'm 37 and I live in Hico, Texas. I was diagnosed with ALS in January of 2015, so I recently celebrated my 9-year diagnosis anniversary. I think mental health as a priority is a no-brainer. It's not something I ever prioritized prior to being diagnosed, or really even prior to the pandemic. But as my world slowed down, as my body slowed down, it definitely became something that had to be taken very seriously and be at the very top of my to-do list. Thankfully, because of the pandemic, I was able to locate counseling services via telehealth, which made my life easier because I could connect from anywhere and I could have that connection without having to be face-to-face in person, which also allowed for me to handle the scheduling and execution of those appointments without having to find someone to take me, worry about what they're doing while I'm in session. Having time to decompress prior or post appointment, and then to really think about what I wanted to discuss prior to the appointment without any of the normal mundane things that happen when you're being taken somewhere, chit chat, planning, gossip, whatever it is. So to be able to strategize that entire experience around me and my availability was really helpful. Some tips that I have as far as living your best life while having ALS definitely include leaning into this community. I am absolutely convinced that ALS only impacts the very best people. And so, while it sucks that we're here and the reason that we're here, we are definitely better together. And I learned so much from different organizations that I follow on social, being involved in her ALS story. I'm a millennial, so I can harbor that connectivity, that feeling of being a part of a community and loved and supported through the internet. and not something I have to be physically in person for, which is also nice. For me being in rural Texas. But if there's events, if there's organizations, if there's any opportunity for you to get involved in this community and meet other people, that is definitely my absolute number one advice. Lean in and let this community love you through this diagnosis. I wish you well. I am happy to see you, and I look forward to being guilty by association for knowing you through your journey. Thanks.
So let's get started with Dr. Rebecca Mills to talk to us about the importance of thinking about our mental health upon diagnosis, how to take care of it, and how to manage our emotions moving forward. Dr. Mills, take it away.
Thank you very much. I'll share my screen here. All right, hopefully you can see that. All right,
Yes.
so I'm going to talk about, just rearranging my screen here, sorry about that. Okay. So thank you for the introduction and thank you for including me today. And yes, I'm a licensed clinical neuropsychologist. I've worked in neuro rehab now for 25 years. And this is obviously a big part of what I do is to help people take care of their mental health in the context of serious medical problems. So receiving a life-changing diagnosis, of course, it's very normal to have strong emotional reactions. So very commonly, people have negative emotions like fear, anger, sadness as they try to face something so difficult and challenging. But sometimes people approach it with numbing or denial, and I'll talk more about that as we go. But either or a combination of both is very typical. On the more positive side, though, some people feel some relief. They've been grappling with symptoms for a long time. They didn't understand what was going on. And sometimes it's a real sense of relief to have some clarity, some answers, and some sort of a plan going forward for treatment or management. And along with that can come some hope for treatment, hope for advances in research and so on. And so it can be a real combination of emotions, which is very typical, that can affect your mental health. So I'm going to talk about taking care of your mental health, particularly in the initial stage or the early stages of an ALS diagnosis. So as I said, early on, you're often in shock, or maybe you're too emotional to even remember what you were told or to ask important questions. And it's very important to have ongoing access to medical and rehab professionals. You're going to have a lot of questions, or your family caregivers are going to have a lot of questions, and you might not remember everything at the very beginning. It's just too much to process. So I always recommend people be assertive to get what you need. You may need to go back to the medical professionals or the rehab team to ask them more questions, to get answers, and to get a plan. And of course, get your questions answered. Hopefully write them down ahead of time if you have specific things you want to understand, and ideally you have a family or a friend present with you, because it's just so much to take in and so much to learn. And of course, be careful what you read on the internet. We always recommend people, if they want to do some reading or research of their own on the internet, please check science-based, well-researched sources. There are a lot of bad information out there, inaccurate information. And ideally, you're offered or you can access mental health support right away. Not everyone needs it or wants mental health support right away or at all, and not everybody is different. But I think it's important that you at least know when and where you can access that support as the need comes up. So why would mental health support be important? As I already said, it is a life-changing disorder, a diagnosis, It's very normal to have those very strong emotions. Some people approach it with numbing, you know, they get kind of numb and you can't even think about it. And that's denial can be very helpful early stages to help people gradually come to terms with things, learn about it, and learn to cope. So either or both, a combination of both can happen. And it's helpful sometimes to have a professional to process this with. Your family and friends are also affected by a diagnosis like ALS. So you as the patient, if you have your own sounding board, your own person to talk to who hopefully understands the diagnosis and who isn't personally involved, that can be really helpful. So however, your family and friends also need help too. And I know that Dr. Kavanaugh will be talking about that a little bit later. They need help too, but sometimes the patient just needs somebody to talk to who for their own support. It's also very important to always remember that mental health needs nurturing and protecting. Mental and physical health are highly interconnected. They influence each other. And if you have better mental health, it can help your physical health. And of course, the opposite is true. But it's a big part of overall well-being and health in general. So it should be prioritized. So the basics of positive mental health, again, in the context of a diagnosis of ALS, often people hear about the stages of grief. And I don't normally go over that with people because I don't find it particularly useful because everybody is different. Everybody goes through the grief process and acceptance, whatever that looks like for each person is very different. So ideally, I mean, there are stages of grief, but they're different for everyone. People can get stuck at different levels. They can approach it in their own personal way. But ideally, there's some level of acceptance eventually. And with that comes some finding of hope and purpose. So I talk about switching gears with people. Instead of your regular life that you're living, it's a switch to things focusing on what you value and what's most important to you. So I work with people to help them find ways to do what they value, even if you do things in a different way. Sometimes people do get very depressed or very anxious, and that sometimes depends on your genetics or your past history, or maybe other life stressors, support, and so on. Sometimes a more serious mental health disorder can kick in, not for everybody, but sometimes. And that will get in the way of kind of moving forward with acceptance and finding some hope and purpose. And depression and anxiety or other more serious mental health problems do need to be treated a little more aggressively. And I'll get back to that in a bit. But I'll talk about acceptance. It's a really difficult process and an important process. And I also find working with people, it is something that needs to be revisited. I say here a few times, but actually it's probably a lot more than a few. It's something that kind of comes and goes. For instance, a person with ALS may, it's the initial diagnosis, coming just to terms with that, getting their heads wrapped around that. And then it might be other things that come up along the way, having to accept a wheelchair, for example, or a feeding tube, or whatever the case may be. Acceptance changes, waxes and wanes, comes and goes, and it's an ongoing thing to talk about. But it doesn't mean giving up. Acceptance doesn't mean just, oh, well, throw in, just give up hope or any sense of living your life and just accepting and just giving up on making any more changes. Acceptance actually is an active, positive process that helps you process difficult emotions, focus on new goals and things that you value, hopefully can give you a greater sense of peace and hope and gets you unstuck. So I do recommend working on that. If you have a more serious mental health disorder, there are 3 pillars of mental health treatment. One is talk therapy. I always recommend evidence-based psychotherapy or mental health counseling with a qualified person. Again, there are some less qualified people that maybe aren't worth your time and money. So do your research to get somebody who can really help you. Another thing to do is to try to get active, whatever that means to you, mentally, physically, or socially. It might mean, and it depends on your health and your interests. But again, it's that finding value and focusing on that and just getting more active. Sometimes mild mental health disorders like mild depression or anxiety can be treated with these two things alone, talk therapy and more activity. But sometimes people also need or do best with some medication added in, and that's something you can talk to your doctor about. It isn't always necessary, but sometimes it's a helpful add-on. And just in terms of everyday mental health management, these are things that everybody should do, but these are the basics that I always recommend. Getting a good night's sleep, moving or getting outside every day, exercise, keeping that activity level up as much as you can. Focusing on hobbies or creativity and positive relationships. So again, it's back to what is important to you, what do you value, what makes you feel positive, hopeful, gives you quality of life. Healthy food, good diet, avoiding excessive alcohol, smoking, recreational drugs, and so on, those kinds of things. They're not healthy coping strategies, obviously. And then practice something that relaxes your body, reduces the stress hormones, but like things like deep breathing, meditation, yoga, listening to music. For some, it's prayer, being outside, whatever that is for you, something that, like I said, reduces the stress hormones, relaxes your body. And practicing that a little bit every day is healthy for you. One final word. Some ALS patients experience brain changes that affect thinking skills, but it's important to note that mental health disorders can also impact thinking skills. So sometimes things like being forgetful and distracted and disorganized, having trouble with making decisions, that can be neurological changes related to ALS, but it can also be related to depression and anxiety. So in those cases, I do recommend an assessment by a psychologist that can help tease that apart. And then you can work with your rehab team or your medical team on how best to support you, depending on what's going on. And that's all I have to say for now. And perhaps there'll be some questions later, but thank you for your attention.
Thank you, Dr. Mills, for providing insightful points on the importance of and reasons besides accessing mental health support, as well as finding ways to do what people value and continue with their life project. So thank you so much. Up next, we have one of my favorite people on the world. I'm just kidding. It is true. So we'll pass the microphone to Dr. Melinda Kavanaugh, who will talk to you about finding the new normal, how to take care for the families of mental health as a whole, patients, caregivers, and the youth within a family unit. So Dr. Melinda, take it away.
Oh, I just adore you, Marcela. It is always absolutely a pleasure and an honor to be a part of any of these webinars. Thank you to the Alliance. Thank you to everyone who's participating. Yes, so as Dr. Mills said, these are huge topics and we have a short amount of time. So I'm going to do my best to condense a really, really important topic, which is the new normal. And I love how Dr. Mills talked about acceptance and being able to move forward and getting unstuck. And I'm going to spend some time talking about that in the context of the family of the individual living with ALS. So we know that families change often quite dramatically as a result of a diagnosis. There's often fear, even some isolation within families because of concerns of how to talk about it. What do you say? How do you even bring it up, particularly with children? There's a lot of concerns around protecting the child. And what we know is when families are not communicating, when there isn't that openness and that ability to share their own feelings, that definitely, absolutely impacts the mental health of not only the person who's living with ALS, but also the adult in the home, the adult caregiver, as well as that child and youth. We also see that a lot of the family changes have to do with changes in job status, where maybe one parent has to stop working because of their diagnosis, another parent picks up more shifts. What this does to the family dynamic and the mental health of everybody involved. We also see that housing changes. And this has come up a lot in my research, where children feel stress and anxiety because there are new things in their lives. There is a hospital bed in the living room, there's a ramp, there are all kinds of new people coming in, whether it's a durable medical equipment provider, whether it's a therapist. And so we see that all of these big transitions can be very, very overwhelming for the children. We also see that, and we know this very, very deeply, that children partake in a lot of caregiving activities. And some of these are like caregiving duties, but some of them are daily intensive care, really filling in that spot to provide that care and support for the person living with ALS. So what we see is all of these things combined post-diagnosis really provides or opens the door for a lot of stress, anxiety, depression, and fear, which are common across all family members, including those children and youth. So what I'm going to talk about briefly is this idea of creating a new normal in your family. So what do I mean by a new normal? So much like Dr. Mills talked about acceptance and, really moving forward, that's what I mean by a new normal. And this is not something that you snap your fingers at and move overnight, or it's something that you just tell your children we're going to do, but it's a process. And it really is a reframing of how we think about living with the disease, doing the same things you did just differently, and integrating those changes, whether they're mental, cognitive, physical, into your everyday routines. So these can be things like, and the children report back to me that these are things that really make a difference. They love going for a walk with their parent. So integrating a power chair, maybe integrating, if you have access to it, a chair that can go over rocky terrain. Maybe if you're really struggling with the loss of voice, how to integrate speech generating devices, how to use eye gaze equipment to communicate, things that adapt and make you live with the disease and creating this new normal, as opposed to the disease existing next to you and interfering, you're integrating with it. And when we think about how we want to integrate that new normal, when it comes to caregivers, and when I say caregivers, I am absolutely recognizing that children and youth and adults all participate in care. But this slide, really, I'm thinking about that adult caregiver, because their life has dramatically changed. And for them to think about that new normal, it's not the living with the disease and how it impacts their actual physical being, but it's how it's impacting the changes that they're seeing in the world around them. It's how it impacts their ability to interact with their person with ALS, with their child, with their grandparent, with their job. And much like Dr. Mills said, and I won't belabor this, but all of these are so, so, so critical for helping not only caregivers manage their own mental health, but really figure out how to integrate that new normal. And that can be through engaging with peer support groups, through engaging with faith communities. How do I make my world a new normal, as opposed to butting up against it and trying to change it or have it interfere with me? How do I adapt and integrate it? And when we think about how we do this for children, the first and most important thing, and I get this question all the time, is how do I talk about this with my children? And this is an entirely other large webinar, but I will say that the most important thing that you can do is talk about it honestly, and even if that means you show emotion. And that's really, really important for our children and youth to see, because they're feeling it. And if they see you doing it, if they see you modeling it, then they feel more comfortable doing it. And that helps to integrate a normal, quote unquote, response to ALS. Another way to help engage your children in this idea of a new normal is help them adapt to the home, have them be a part of that. Ask them, like, hey, do you want to try helping to build these rails? What do you think if we put the bed over here? What is it like if we build a ramp outside? Have them participate in these adaptions. That makes it feel like they have more agency, more ownership in that process. And it also helps them to feel like this is a normal experience. And very much so addressing some of those cultural and spiritual expectations that go along with living with an illness. Encourage spiritual care, encourage cultural activities that help them feel like those things are integrated into their everyday lives. And when things progress, because we know they will with ALS, that the children are part of those adaptations. So things are changing with your speech. Things are changing with your swallowing. Help them integrate and say, what kinds of foods are better for me now? How can you help me create a list of words that we might be able to use as a device speaks for me instead of I speak for me? And the biggest takeaway on this one slide, recognizing this is a huge topic, is that when you are integrating the new normal to your own being, you're able to model that to your children. And it's very difficult. And I absolutely understand this is not a process that happens overnight, but showing and modeling and engaging your children helps them feel like their new normal is actually a good thing and that they can adapt to it. I put this slide in here really briefly in my last few minute is I always want to integrate something about grief, and particularly anticipatory grief, and the role this plays in the mental health and well-being in our children and youth. Because much like I said, we're integrating a new normal, but as things change, that new normal is changing as well. So from one progression to the next, as children are seeing these losses and they're trying to adapt to a new normal, the support that they need is absolutely critical to talk to other youth, to talk to professionals, and to get the support that they need. And we have lots of materials out there, as Jess said, and I am incredibly proud to say that Alper just translated our graphic novel into Turkish, but we have materials that are in multiple languages. There are resources around what is ALS, how do we talk to our children, what kind of caregiving support and education is available. So this is work that I've been doing for many years with all of these amazing colleagues. And if you look on the website, it's globalneuroycare.org. And that's a global foundation myself and colleagues created just a couple of years ago to kind of put all of these materials together to create an opportunity to support children and families around the world. So it is global access. So I'm going to stop because I think I'm at time, but thank you very much. It's always an absolute honor to be able to talk about children and youth and families. And I look forward to any questions you might have.
Thank you so much, Melinda. So much of what you have said resonates with me, of course. Reminds me of when I was a child, a caregiver to my dad. So thank you. Just remember, everyone, if you have a question, please add it to the Q&A box, and we will get to them at the end of the webinar. So now we're moving on to have a conversation with Alper, who will share with us his lived experience living with ALS MND. But however, his diagnosis has not stopped him from pursuing his passions. So let's hear more about this. Alper, I'm excited to have this conversation with you. So Jessica gave us at the start of this webinar a brief introduction to you, but I would like to get us started with you telling us a little bit more about your hobbies. I have heard you are a musician.
Thank you very much, Marcela, and for the organization and this webinar and having me here. Actually, there's not to say about the life. The life is always is not the fair, you know. But I want to start to the words of Rumi. Rumi says, this is your path and you're alone. Others may walk with you, but no one can walk for you. The journey is unique for you. And I am living with ALS for over 30 years. And this is ALS, many faces and heterogeneity, you know, and 20 years of tracheostomy and my ventilation in making my life. And now I am here. And I want to say a couple of words about my journey in the 7 bullets, under the seven bullets. Like everyone faced with the ALS, the first stage is breaking news, you know. And as we know, Kubler-Ross, 5 stages of grief, just Melinda talks about, and the introduction to the diagnosis and the stages. Of course, all we have faced these stages, and I have faced these stages also. And another thing, important thing, I think, that the stages must be completed in the as soon as possible, because it takes much time, and stealing the time from our lives. And so I wanted to tell you about a simple and short anecdote. I was working in my private office, and I was very angry, and I was in denial, anger, and bargaining and depression, the stages of the grief. And one of my ophthalmology patient in front of me, middle-aged man, said that, "What's wrong with you, doctor?" I said, I was given diagnosis ALS. And my patient looked at me in a serious way, and he said that, "You know what, doctor? I lost my children to a tragic traffic accident." And immediately I found another way to look at the life and another angle to be able to find their life. Anything can be happen, and the children was scary and, you know, like a tragic way. And another on the other stage, ego clashes. I would like to call it ego clashes. And I was in the clash of my old ego and the new one, like Melinda said, because I don't know what is the new normal. And I agree with Melinda that we have to find a new normal, so it can be a point of view, a new point of view. And another issue was communication solution. And I found a way, assistive technology, to communicate my family and my friends, and lately the internet. And then I realized that, yes, okay, I have many lost, and ALS is a life game, playing with the losing through the losers. And what's left for me? And I understand that something left for me. And I was 197 disability in my life, but I have 303 percent of my disability was my mind, and I try to find my strengths and weakness. I found the music, my hobbies. The hobbies, my hobby was music, and I was playing classical guitar with the Bach and the old times, and I realized that the muscle memory is very important for me, and innovation in music, for making music in a new way, and finding peace. Inner peace was very important because I had to make peace in my journey, and I tried to find what is the advantages in my hands. I saw that the sensorial system was fair, so I can hear, I can feel, and I can do something with the physical power in my hand. And sensory experiences was very strong as an old classical guitar player. I can use my fingers, I can use my position, I can feel my vibration of my guitar on my chest. So I try to recollect all the things I can do again, and I find a new way to make music. And I'm not an expert in mental health, but I can say that I'm an expert in my own life. There's something I have learned in my journey. Let me say something about it. And I'm making peace with yourself is very important milestone. It's not easy to that, but to understand yourself, don't dig too much into yourself. First, get away from yourself. Find another subject, a hobby or trivial person. I recommend something not only for people living with terminal illness like ALS, but also for people who take care too much about themselves. We are a very insignificant being in the universe, but we are also the most intelligent creatures we know in the universe. And intelligence is a value that we assign to ourselves after what we can do, despite everything. And I'm a doctor, a physician, and who has taken the Hippocratic oath. And my priority is responsibility of my oath. And I am on journey as a father and a husband on my way, and found another thing. And another thing, if I put another me away from myself, and that was Alper loves music and art. Music and universal. And it's not an effort of it just hearing. It moderates and enriches the connections in the brain. Art is for me encoding the presenting everything that happens in our soul in another form. And assistive music is a way to do that. And in my journey with ALS, my wife is facilitating and illustrative, inspiring companion who makes the whole journey possible. Our maternal instinct give our family strength and resilience. And the team spirit is the basic rule of the journey. And I say that two lovers are the greatest team. And that's some words from me. And thank you very much for this session. I'm ready for the question if you have a time, if I'm not talk too much.
Thank you so much, Alper, for sharing your lived experience with living with ALS for 30 years. And giving us some invaluable recommendations for people living with ALS worldwide, how they could be resourceful, finding ways to pursue their hobbies. And I want to thank you because you found a way to transit your journey, your life with a lot of resilience. And I hope this inspires a lot of more patients and people living with ALS worldwide. So before we move to the Q&A, I would like to ask each of our panelists, what is your top recommendation for maintaining mental health, transiting this disease? So let's start with Dr. Mills.
Top recommendation for maintaining mental health. Well, I only have one. I think one thing that I find very difficult and feeds into a lot of chronic mental health issues is being afraid of your emotions. And so I think there's lots of ways you can get help with that. But that's one thing that I often find myself working on with people is not be afraid of your emotions. Your emotions are part of who you are. They're very important. They're very useful, and sort of avoiding them or stuffing them or can lead to other kinds of problems. So that, I think, is my top one.
Perfect. Dr. Kavanaugh, what would be your top recommendation?
Well, I kind of want to say what she said, but but the first thing that popped into my mind, and the thing that I tell families all the time, is being willing to communicate, to talk through whether it's your emotions, your experience, your fear of progression, your fear of death and dying, and all of those things are absolutely part and parcel of our mental health. But to me, what really helps is that willingness to talk and to have those conversations. They're difficult, they're stilted, sometimes they feel ugly, but just doing it and having the conversation, I would say, is would be my primary.
Thank you. Alper?
Yeah,
What is your top recommendation?
I would say that honesty and be clear about what you think, what you need, and what you feel. And so you need a partner or whoever in your environment, in your family, and be honest and be open and be very friendly way, and be yourself, what you feel, what you need about it, what you need. And so this is I think the crucial thing, openness and being yourself, because maybe you are not the one, the old days like it used to be, but you are the one at that moment, what you feel and what you like, the feeling. So maybe some people bias about your personality, but you are the person at that moment as you are. Yeah, that's my first recommendation.
Thank you, Alper. So thank you all of you for your presentation and answering all of our questions. We still have time for a couple of Q&A questions that we got ahead of time. So there's one that says, what can I do so that my children understand they can carry on with their lives? Dr. Kavanaugh, could you take that one, please?
Sure. You know, I think that taps into what a lot of parents feel is this concern that ALS, MND is somehow limiting their children, putting up barriers to opportunity. So I absolutely understand this question, and I think it's probably a fairly universal one. So whoever asked it, I give you kudos for being willing to reach out and ask that question. One of the ways I would respond is to actually circle back to my presentation. This idea of integrating ALS into your life in a normal way so that it becomes just simply a part of how we interact, how we adapt, how we think, how we support each other, in that it isn't something to constantly be avoided or overcome or run up against as a barrier that then they have to escape from at some point, right? Because the assumption underlying that question is that you know, they're kind of trapped in this, if you will, or that they have to kind of get away from it. So if you're able to, as a family, work through and create that as part of your new normal, then that helps that conversation around how can my children kind of move past it. But the other way to respond to that is constant reassurance to yourself as the parent and to your child or your youth that they are their own person and it's okay. Give them the space and the approval and the opportunity to do things that they need to do as an individual, as a child, as a student. It's again about those conversations. So I won't take up too much more time, but yeah.
Thank you. Yeah, I totally agree. We have another question. What advice do you have for a caregiver whose spouse is not wanting to do anything to help themselves? Dr. Mills, would you mind taking that one?
Sure, and I think that means with respect to their mental health, or do you mean, is that what the way you understand the question?
Yeah.
Yes. Well, again, I probably go back to some of my presentation and also Dr. Kavanaugh's presentation of the going on the acceptance journey, and it is really hard. I mean, as Alper talked about, the stages of grief, which are a little different for everybody, and people get stuck, and it sounds like that sometimes people get stuck at that level of not accepting and not just being so overwhelmed by the negative news or the lack of hope, and then finding a way to work through that, probably with a professional. That can be very helpful, but if possible, it could also be finding support groups or joining with you know, your culture, your spiritual organizations, finding a hobby, finding that way to have some kind of new purpose or activity that can be really give you a better quality of life and focus towards those values and that quality of life. But if they're really stuck, I do recommend professional help to help the person work through the diagnosis and the acceptance, which is a difficult journey, but it's a good journey if you can do it.
We have a question at the in the chat. Does grief vary depending on gender or age? Who wants to take this one?
Wow.
I know.
I'm not sure how to answer that. I think certainly the way women and men experience and express emotions, I don't want to be too sexist, but there are some differences. Ultimately, men and women are very similar at their core on how they experience emotions, but they express it differently. So it can look different for men and women. I'm going to be really generalizing, but probably, maybe some of the issues are a bit different, but the emotions are probably really similar. It just looks a little different. Age, I'm not sure. I mean, I that's something maybe somebody else can answer. I could only imagine that younger people and older people would approach grief differently, thinking of your lifespan and your life experiences, but maybe Melinda has more to say about that.
Certainly I completely agree what you're saying, kind of gender responses, but with children, we do see some differences in how children process and display grief. Don't be surprised if there is some acting out, or if there's some lack of willingness to engage around the conversation of the person who is either dying or has already died. They can either act out and almost display some issues around complicated grief, reverting back to a younger age, refusing to engage in conversations around the person, almost showing anger, or at the same time, we also see that children can really fold into themselves and refuse to communicate about anything. So with children and grief, we often see the extremes. We see lots of acting out and kind of aggressive behaviors, or we see a lack of willingness or ability or interest to communicate at all about it. So that's why I say over and over again throughout the entire process, encourage communication. So when you get to those grieving stages, those children have had modeled behaviors.
Yeah, it could go either extreme. So we have actually a couple of questions. I'm gonna try to unite them as how can I reduce the mental stress to my caregiver wife? And there's another one. Any recommendations for the caregiver to get some sleep, since sleep is critical for mental health and is a short supply for many of us? Who wants to take this one?
I currently do some research on sleep in children who are caregivers. So, I mean, I can speak to that, but I want to be really clear. I'm not, primarily a sleep expert, but I know when it comes to children and youth and young adults, they need a lot of sleep and emptying one's mind before you go to bed. So we encourage our kids to write things down, draw out their feelings, draw out their emotions, kind of get things out of their brain before they go to sleep so that doesn't kind of override their ability to sleep. Also continuing to talk through any concerns, being able to have active lifestyles. So that also, as we age, being able to be as active as possible, whether you're a child or an adult, being an activity, particularly with people who understand your experience and can share in that. Those are the experiences I have with children in sleep and helping them obtain a better night's sleep as a caregiver.
Thank you.
Yeah, I would say all those things, making sure that the sleep disruption, if the sleep disruption for the caregiver is related to lifestyle or stress, anxiety, mental health, then yes, they need that support to improve their sleep. That's a sort of one angle, but the other is sometimes just the practical. If you're up in the night, often helping your spouse with, getting to the washroom or turning in bed or whatever the case may be. We often try to find some help, some respite care of some sort, share the load with family and friends. If people offer help, please take it. Don't be so proud. It's really important that the caregiver has good health, mental and physical health, because there's a lot of, you're needed, you're important. And so those are just some basics that I would recommend, is use the help that maybe hopefully is offered to you.
Okay. Thank you all. I want to give a special thank you to all of our panelists. Thank you for participating today with us, and I will turn it back to Jess for the final wrap up.
Before we wrap up, I really hope this works. We want to share with you a clip of a song written by Alper, dedicated to all of you living with ALS and MND, and for those of us who have lost loved ones to ALS. Alper wrote the lyrics, and the music was created with the support of Suno AI. So fingers crossed this works.
In the stillness of the night, a battle rages on. A silent enemy creeping in and stealing song. It takes control, the body weakens day by day, but still the spirit fights, searching for a way. For trembling hands and weakened limbs, we find the strength to cope. The journey may be long, but love will give us hope. In every step we take, in every breath we breathe, together we will face this, no matter what's decreed. We won't let go, we won't give in. Though the road is tough, we will rise again. With every beat of our hearts, we'll keep standing tall. For in the face of ALS, love conquers all. Conquers all.
Now, on behalf of the Alliance, I want to say thank you to our panelists. The tools and the recommendations you shared with us today highlight the importance of prioritizing mental health along physical care, and that there is support, information, and help available. Thank you again to our sponsor, Mitsubishi Tanabe Pharma, who makes this webinar series possible. And a big thank you to you, our audience, for joining us today, for pre-submitting your questions. I want to wish you all a great morning, afternoon, evening, wherever you are in the world. Thank you.
Thank you.
Thank you, Jess.
Thank you. Have a
Thank you.
nice
It's
day.
good to see everybody.
Thanks.